All right, so we got Kristina and Miracle here again. Today we're going to focus on common exercises for core weakness and hip weakness.
Okay, so the first exercise is going to be a stretch for the side of the hip. And Miracle's gotten into position here, stretching the right hip and involving the thoracic spine as well. She's using her elbow to put some force through the knee, counter force, rotating upper body to the right. Her right leg's going across her body. These stretches can be held for 30 seconds, 3 repetitions, or you can do short holds 10 times, pausing at the end range each time. Come back to the center, and then, if appropriate, you'll do the other side. And relax.
Next portion is for stretching of the IT band, which is a common problem a lot of patients have when they come to the clinic to see me.
So a foam roller can be used to reduce sensitivity, improve mobility, and I'm just going to go in small portions, a minute or 2 at a time, dividing up the leg into 3 or 4 sections. Might be a bit tender or painful, that's normal. Do it to your tolerance. And you can just go down the side of the leg, the front of the leg. You can do it on the quad and the IT band and the area sort of in between. And foam rollers can be found at Target or any sporting goods store or online.
This next portion will focus on stretching the hamstring.
So it's helpful to use a strap, something that doesn't stretch. It can also be a beach towel or belt, dog leash. I'm going to put one end around the foot. Miracle, you can lay back. I'm going to lift up with a straight leg until a stretch is felt in the back of the thigh and knee. If this is too much of a stretch, you can bend the opposite knee to take some of the stretch off. This should be held for about 30 seconds. Rest in between. And we'll do 3 repetitions. So the single knee to chest exercise can be used to improve mobility in flexing the hip we're pulling in. Can also stretch the hip flexors on the side that's staying straight. So Miracle holds here. You're going to pull in, 30-second holds, 3 repetitions, resting in between. And then if needed, also do the opposite side. If there's any knee problems, you can hold underneath the knee so you're not putting pressure on the knee joint. So this is a series of hip exercises, important for strengthening the gluteal muscles. The patient can be lying on their side, head on a pillow for comfort. The first exercise, external rotation of the hip or clamshell. Just lifting and lowering the knee with a bent knee, getting to just past the neutral plane. Ten repetitions, 3 sets. This can be advanced by putting a weight at the knee or a resistance band around the knees. Internal rotation of the hip in the same position. Knees stay together, lifting the foot. Same repetitions, 3 sets of 10. Resistance here would go with the ankle. Straight leg abduction of the hip. You want to have the hip rotated slightly forward. Leg in a straight line, slightly behind the hip bone, and lifting up the top leg, just breaking the plane of neutral again. common compensation, people tend to roll backwards, and that loses the contraction at the muscle we're targeting.
So it's important to keep that hip rotated or forward.
Hip rotated forward. And last one for hip adduction, we'll put the top leg in the front, stretch the bottom leg out, and lift the bottom leg. It doesn't go very high, just whatever you're capable of. And again, shoot for 10 repetitions, 3 sets. Once a day, every other day would be fine for these strengthening exercises.
Okay. Great.
Stretch the IT bands, the lateral thigh. Supine, lying on your back with the strap around the foot. Gonna lift up and across the body until you feel a gentle stretch down the side of the thigh and into the hip. 30-second holds, 3 repetitions. Coming down in between.
Okay. Great. Do you want to mention what you mentioned to me with regards to the abductor strengthening? If the external rotation versus abduction, which is more important? Which one? What's your protocol? How do you go about recommending one to versus the other?
So ideally with hip abduction strengthening, because it has to work with a straight leg when we're standing and walking, the straight leg exercise is more effective versus the bent leg clamshell exercise. But not everyone can perform the straight leg one inside lying properly at first. So I often give the clamshell exercise as an initial exercise to start recruiting the glute muscle, and then work our way up to higher level strengthening with the straight leg abduction exercise into the side plank.
Okay. So for more severely deconditioned patients, you start with the external rotation and then work your way up to the abduction.
Yes,
Okay.
exactly.
Great. Well, Kristina, thank you. Miracle, thank you.